So I've just seen a lady who her complaint is the fact that she's got catarrh in her ear. Now, what does that mean? So catarrh basically is it's a loose term that a lot of people use to refer to fluid or some sort of congestion in one's middle ear. Much more common in children, and with children we often phrase it, we call it glue ear, which actually isn't really specific enough because glue ear would be one of the later stages of what we would generically call otitis media with effusion. So in this case, this lady has been using crystals and menthol in order to reduce and relieve some of the catarrh in her upper nasal tract that might have an effect on her ear. Actually, she had wax anyway, which would have been the main reason why she's here, because I think it's the wax rather than the catarrh that's causing her concern. But once the wax was out, I could see her eardrum, and you'll see it over this video. You could see there's a very faint signs of fluid building up in the middle ear. It's not infected, so I'm not concerned at all. We would normally use this test called tympanometry, very, very valuable, and it tells us exactly what's happening with the eardrum, how well it's moving, if there's any fluid on the other side, and that's how we basically are able to diagnose if there's any middle ear problems. So it's a very valuable test. In addition to otoscopy, can tell you a lot about the people's the integrity of the audio pathway. So in her case, I think nothing to worry about. I've given her some advice about actually using some inhalation therapy, just inhale steam for a few weeks, and hopefully that should lead to the fluid clearing, the eustachian tube doing its job, and then hopefully she'll be back to normal again. In some cases, if the fluid stagnates and stays for too long, it can get infected and it can become very, very immobile and tough, in which case sometimes it can lead to surgery requirements. It's a very simple surgery called grommet surgery, where they do an incision in the eardrum, drain the fluid, and they leave a small pocket in the eardrum which falls out within 6 months. So just something I thought I'd share with you in terms of the interaction I just had. As always, I'll see you next.